You're listening to Taking Care of Business with Marty Pay and Clay Kerner on Kern Radio Newstalk 1180.
I love that music. We are back on Taking Care of Business on Kern Radio Newstalk 1180. You know, Clay, since you and I are both in the insurance industry and you do a lot of healthcare, this is one of those guests who I've really been looking forward to have. Sally Pipes is a Taub Fellow in Healthcare Studies. She's the President and Chief Executive Officer of the Pacific Research Institute. And Brian Calais, who we had on a couple months ago, told us about Sally. And before becoming president of Pacific Research Institute, which is in the Bay Area, in 1991, she was the assistant director of the Fraser Institute, which I'm familiar with in my home country, in Canada, just around Vancouver. Sally addresses national and international audiences on the healthcare issues. She's been on the Glenn Beck Show, the O'Reilly Show. She's been on Neil Cavito's show. And Sally, you haven't made anybody walk off of The View, right? You haven't done that yet.
No, not yet. No.
Okay, but there's, you know, I mean, the year's still young.
Right, exactly. No, I'm not Whoopi Goldberg.
Well, Sally, welcome to Taking Care of Business.
Well, thank you very much for having me on.
You know, I have to tell you, one of the things I did in preparation for this show was watch a debate that you had on Pacific, on your website, and it was about the government response. Is the government responsible for health care? And your arguments were great, and I was listening to some of the people on the other side of the argument, like Paul Klugman, and I'm listening to this thing with my pen in hand, waiting to see if there's anything significant we could discuss coming out of Paul. There's nothing on the argument on the other side that even sounds coherent. It's an interesting argument on their side.
Well, you know, and it was interesting because that was my big victory over Paul Krugman, because after I gave my arguments about the Canadian healthcare system, he then asked the moderator, John Donovan from ABC News, if he could ask the audience a question, to which he said yes. And Paul asked the audience how many were Canadian, and about 7 people out of 400 put up their hands. And then he said, well, how many do you like the Canadian healthcare system? And not one put up their hand. So Paul Krugman kind of put his head down and said, ooh, I shouldn't have asked that question. So I figured it was one of my victories. It was just prior to him winning the Nobel Prize in Economics.
I think the only people in Canada that love the system are those that don't use it. Exactly,
and that, you know, if you're healthy and well, it doesn't really matter. Or if you just need to, you know, if you've got a sore throat or a bad cold, you can, you know, see a general practitioner or a primary care doc and get treated. The people, if you need to see a specialist, that's where the problem comes in, because the average wait today in Canada from seeing a primary care doc to getting treatment by a specialist is 16.1 weeks, i.e. 4 months. And that's why so many Canadians, not just wealthy Canadians, but middle-income Canadians, come to the United States and pay out of pocket for an MRI or knee surgery or hip surgery or getting heart valve replacements, because, you know, if you have severe headaches and you think you might have a brain tumor, you don't want to wait 4 months to find out you have one, and then another 4 months to getting the surgery.
You know, Sally, I think, this is Clay, I think the goal is always to affordability of health care and access to health care and quality health care. And I guess my question to you, and maybe you can expound on this a little bit, should government be responsible for our health care?
Well, absolutely. I mean, I believe that, you know, the goal for all Americans is affordable, accessible, quality health care. The question is, how do you achieve that? And there are two visions. One, which relies on empowering doctors and patients and encouraging innovation in, you know, medical devices, pharmaceuticals, and biologics. The other, of course, is increasing the role of government. And I'm a big fan of the former, but, you know, President Obama, Speaker Pelosi, Senate Majority Leader Harry Reid, under Obamacare, they support increasing the role of government in our healthcare system through increased taxes, mandates, subsidies, and controls on insurance companies. And that's what we have, you know, under Obamacare. And, of course, you know, the polls are still showing that 58% of Americans would like to see Obamacare repealed. I mean, there is not support for it. And I think very few people realize that 50% of our healthcare industry was already in the hands of government through Medicare, the program for our elderly, Medicaid, the program for low-income Americans. state children's health insurance, and, of course, the VA system. So I think that the last thing that Americans want is for more government health care, and they know that Medicaid is very difficult. It's very hard to find a primary care doctor, and we have real examples of this in Massachusetts under Romney Care, where, you know, Medicaid people, 20% cannot get a doctor because docs don't want to take Medicaid patients because the reimbursement rates are so low, and increasingly our seniors are having a hard time finding a doc. 1 in 3 new Medicare eligible patients cannot get a doctor under Medicare because while the rates are not as poor as they are under Medicaid, they're still 20% below what a doc will get from seeing a regular patient.
Well, in Massachusetts, as you I'm sure are aware, a number of carriers are pulling out of the state and not offering benefits anymore.
Well, absolutely. I mean, and in particular, I mean, you know, Romney thought that, you know, just like Obama, we could achieve universal coverage in Massachusetts and bend the cost curve down if there was an individual mandate and an employer mandate. Well, what we've seen is, of course, health insurance in Massachusetts is the most expensive in the country. As I just said, 20% can't find a doctor. And third, the increase, there's a 9% increase in the use of emergency rooms in Massachusetts, which was exactly what they were trying to get away from, because these, you know, low-income people can't get a doctor. They're increased their use of the emergency rooms. And then last, the Harvard Pilgrim, which is one of the top 4 insurers in Massachusetts, they just announced 2 weeks ago that they would no longer be writing policies for seniors under Medicare Advantage because the reimbursement rates to the insurance companies from the federal government under these reductions in Medicare Advantage, a private program for our seniors, are too low. So you've got 22,000 people in Massachusetts, New Hampshire, and Maine who are eligible for Medicare Advantage are not now going to be able to get insurance under Harvard Pilgrim.
Well, the government's trying to get rid of Medicare Advantage plans as they are today anyway, so they can move everybody back into the standard Medicare program where they have more control.
Yes, and, you know, a quarter of our seniors, about 11 million out of 45 million seniors, you know, are on Medicare Advantage, and they really like it. But the president, in, you know, several of his 58 speeches that he gave on health care reform and health insurance reform before the Affordable Care Act was passed, he said he wanted to get rid of Medicare Advantage. And sure enough, I mean, the first goal is to reduce reduce Medicare Advantage by $202 billion. And so Richard Foster, the chief actuary at Centers for Medicare and Medicaid Services, has said that, you know, there are 11 million seniors on Medicare Advantage now. By 2019, that number is going to be down to probably about 2 million and then it's ultimately eliminated.
You know, going to another part of the bill, you're probably aware that they said kids between 0 and 19 will have guaranteed issue coverage. You familiar with that clause? Oh,
yeah, absolutely. And, you know, one of the controls on insurance companies that came in on September 23rd, which was, you know, a good move on the part of the Obama administration to, you know, say on September 23rd that insurance companies, you know, would have to allow young adults to stay on their parents' insurance plans to age 26. Mm-hmm. There could be no denial of insurance for children if they have a pre-existing condition. There could be no co-pays or co-deductibles for preventive care, mammograms, diabetes testing, and of course there could be no rescission, no deny or getting rid of an insurance coverage when a person is ill. Of course, that was illegal already. And then starting on September 23rd, the other thing was that insurance companies would start the reduction of annual limits and lifetime caps, so that by 2014 there could be no lifetime caps or annual limits on an insurance plan. And of course, so the idea being that since children were going to be able to get insurance, regardless of whether they had a pre-existing condition. I mean, what's obviously has happened, and which was, you know, inevitable, insurance companies said in certain states that they were no longer going to write child-only policies, and particularly in California, Anthem, Blue Cross, United, they said that they wouldn't be writing these plans. Now, of course, the government, under Secretary of HHS Kathleen Sebelius, you know, she has about 1,000 issues that she is able to control as you know, on this healthcare reform. And they've got some waivers saying that insurance companies will be able to write child-only policies and make them actuarially adjustable. But, you know, we're seeing a lot of the things that I had predicted a year and a half ago are actually coming into being, and they're not good for Americans and their health care, because government is getting more involved. And I believe ultimately the goal of Obama, Reid, and Pelosi is to crowd out private insurers and leave all of us in a Canadian-style Medicare for all single-payer healthcare system.
Well, we know that's the objective. Sally, we've got to take a quick break.
And when we come back, I'd like to talk a little bit about your book as well. So hold on with us, if you would. This is Taking Care of Business, Kern Radio Newstalk 1180.